Dr. Cynthia Snider from Cone Health is here with us answering your COVID-related questions. This person texted in, I bought groceries, then tested positive a day later. Should I throw those groceries out to keep from spreading to other family members?
We don't believe that the SARS-CoV-2 virus hangs around on food or plastics that long, so your food is safe. I would say, though, the people who live with you still need to get tested and wear masks in public until you get the results back.
So family members, get tested, don't throw the groceries out. All right, what is the latest information when it comes to vaccines and pregnant women?
We're finding more and more data that is showing it's very safe, and the maternal antibodies that the mother develops passes on to the baby and the newborn, so that is even more protection, even for breastfeeding. So there isn't really any contraindications for pregnant women to get vaccinated.
This next question is, what is the shelf life for the COVID-19 tests that were recently mailed to folks?
I believe it's a year. It could be longer. The key thing that you can find out, if you look at the box, there should be an expiration date there printed.
Always best to look on the box, see what the manufacturer says. All right, do kids get worse side effects from the vaccine?
That is not I don't think it's necessarily proven that they've had worse side effects. The side effects can increase with the bigger doses. So, kids under 11 have a smaller dose than those who are older, who are 12 and over.
How about this one? Can you get two different variants within a short time of each other?
We did see some of those cases happen, especially at the end of the year. If somebody had essentially had Delta towards December and then subsequently had COVID again a month later, and it was more during the times of Omicron. So we saw some cases like that happen.
This next question is, how soon after exposure should I get tested, especially if you have one of those home kits at home?
I think getting tested between days 3 and 5, and then you could test again at day 7 just to make sure.
All right, so this next question is, I'm vaccinated and have natural immunity as well because I had COVID. How protected am I? Like, are they more protected than someone else who just has the vaccine?
That is a good question, and it really matters on how you got the infection and then got vaccinated. What it turns out that if you've had natural infection and subsequently had one more dose of vaccine after you got infected, you have like very high antibody levels.
But that only is high antibodies for that strain of COVID. Could you get the other strain?
That it's a good question. It's very hard. I think it boosts your immunity to the point where, it still protects you against severe disease. But to get just an infection, it's probably still all about the same.
Okay. All right. This next question is, are case counts still a good metric to track with, especially since at-home tests are not reported?
I think that's the crux of it. We know that the numbers that we're seeing are probably an underrepresentation because not a lot of people are reporting their home tests. And so we also look at how many respiratory illnesses are showing up in the emergency rooms. We also look at how many positive tests we have in other like asymptomatic populations. And with all those data points, it helps us decide like where the true prevalence is in the community. Okay. So the health department realizes it's not perfect, but it's one method that they look at.
Okay, we have about a minute or so left. This next question is, do I need to stay away from my pets if I have COVID?
There's more and more reports that they're seeing animals having COVID illness, or maybe I would just say they're detecting COVID infections in animals. And but I'm not necessarily sure if it warrants like treatment, right? It's generally thought to be a cold. Again, it's just really kind of like hand hygiene, not to spread it to anybody in your family. But I'm not really familiar with how to protect your pets from it.
I mean, I just think of, you have your pets and they're usually close to you and you're usually like face to face with them thinking about that. Okay. Thank you so much for your time and your expertise today. We so appreciate that. If you missed any of the information, what we want you to do is go to the To Your Wellbeing section. It's on our website. All of it's posted there on WFNYnews2.com.